I'm often asked, what is a long-term acute care hospital? My definition is that a long-term acute care hospital is an acute care hospital that specializes in the treatment and rehabilitation of medically complex patients who require a long length of stay. The interdisciplinary team is made up of those clinicians that have a stake in the patient's recovery. It is led by, of course, the attending physician, nurses, pharmacy, nutrition rehabilitation, occupational therapy, speech and language pathology, as well as physical therapy. And these 7 or 8 people set goals, mark progress, and coordinate the care so that the outcome can be as best as it possibly can. Our patients are as sick as patients in short-term acute care hospitals. However, our goals are different. In the short-term acute care hospital, the goal is to keep that person going day to day. In the long-term acute care hospitals, the interdisciplinary team's job is to look at the entire patient to decide what are their medical conditions, what is their treatment plan, what are some reasonable goals, and then to coordinate everyone's interest around meeting those goals. And those goals are not, will they make it through the night? Those goals are, what do I want the patient to look like 3 days from now, 2 weeks from now? The fundamental question is the best place for me as a patient in a hospital where people like me make up only 1 or 2% of those patients? Or is it in a place that is filled with people just like me, with a large burden of illness, with a lot of complexity, and a place where the staff looks at me and says, I recognize this type of patient. I know what to do. I know how they're different, how they're unique, and how they're special. This is what we do. We can provide for you and your loved one what you're looking for: hope, healing, and recovery.